Yeah, one of the more interesting things that I see at Caring Medical is when a athlete has an injury of the triangular cartilage complex in the wrist. And I got my good friend Sam here, that's the skeleton that we use at Caring Medical. And what you can see with Sam is he has limited radial deviation of the wrist, but ulnar deviation, or this motion, ulnar deviation, he has a lot of ulnar deviation. And what cushions the wrist over here by the ulna bone is the triangular cartilage complex. So in other words, you can understand if somebody's a gymnast and they're tumbling, and they got all their weight on their hands. And a lot of athletes put a lot of weight on their hands, like, when we do push-ups, or if you're in a sport like soccer or rugby and you're continually falling and you're putting all your weight on your wrist, you can understand that that cushion or that cartilage complex can get torn, can get injured, can get degenerated. So just like cartilage injuries in the knee and the shoulder and the hip, that cartilage can get torn, can get degenerated, can get painful. And once it gets painful, the person can't put a lot of pressure on their wrist. So imagine a gymnast that they can't put a lot of pressure on their wrist. I mean, they're not going to be able to do uneven bars or all the other types of athletic things that they want to do. And normally, when they do surgery, normally they remove it. And I don't know about you, but I don't want my cartilage removed if it doesn't have to be, because once you remove cartilage, that part of the body, whether it's the knee or the wrist, it tends to degenerate at a quicker rate. So while short-term surgery might be a good solution, I don't think the results are good long-term. Athletes that come to Caring Medical want to get stuff repaired, and honestly, they want to get it repaired as quick as possible. I've been treating triangular fibrocartilage complex injuries for 20 years, and Prolotherapy works great for it. Typically, when you've injured the triangular cartilage, I can guarantee you've injured the ligaments on this side of the wrist, on the ulnar side of the wrist, the back of the wrist, and you've also injured the ligaments on the front of the wrist. So while the person, the MRI might show that you have a triangular cartilage injury, it's torn or it's degenerated, I can guarantee you also have wrist instability. You have carpal instability, where the ligaments attached to the bones here, the ulna bone and the carpal bones, the wrist bones, those ligaments are stretched out. So in other words, even if you get the triangular cartilage removed with surgery, you haven't done anything with the ligament injury or the wrist instability. So how we treat it at Caring Medical is we do injections right into the triangular cartilage to stimulate its repair, and then we treat the ligaments on the ventral or front side of the wrist and then the back or the dorsal side of the wrist. And Prolotherapy stimulates those ligaments and the cartilage to repair. Most athletes, we see 4 visits. The good thing is athletes can start back to their athletics right away. I mean, we might have to modify it a little bit where they can't go back full out right away, but normally you feel better right away. 2 out of 3 people feel better after the first visit. Typically, the athletes make a complete recovery. So realistically, I think in the future, the gold standard for triangular cartilage complex injuries is going to be Prolotherapy.